myself. I'm Claudia Sanchez. I'm a third-year medical student at UTMB.
I'm Korosh Bahrami. I'm a second-year medical student at UTMB.
And I am Isabelle Bergman, and I'm a second-year MD PhD student at UTMB.
Okay, so you did already say the title for our presentation, so I don't want to reiterate that. The reason why we did this project is due to the inequities in the COVID-19 vaccine rollout that had created disparities in uptake across the US, leading to risk of COVID-19 immunity being unevenly distributed. And this relates to vaccine hesitancies that's compounded the issue of accessibility and systemic inequities. In East Texas, there's a digital health platform called Community Health Integrated Response Portal, which we refer to as CHIRP. And it's been developed to help the community health workers utilize vaccination rate data, community partner data, and CDC's social vulnerability index data, and their outreach efforts in an integrated and semi-automated fashion. The study design was semi-structured interviews of CHIRP users, the community health workers and managers and designers of the platform. The purpose was to better understand the work of the community health workers in a 100-county area in East Texas community served by Texas AHEC East, which on the left you can see the map of AHEC East, and then who work with CHIRP and to access the effectiveness of CHIRP as a tool to mobilize available data to improve COVID-19 uptake and strengthen community partnerships. And AHEC East kind of focuses on different communities with lower socioeconomic status or health inequities as well. So for the methods, we had 2 rounds of 16 total interviews with 10 participants who had been conducted since February of 2022. And the participants included 4 CHIRP designers, 2 clinical health managers, and 4 clinical health workers. And they were core members of developing this platform and using the database too.
And so we found that most community health workers consistently use various mapping features in CHIRP to guide their outreach. And specifically these maps, which you can see in the center picture, include CDC SVI data by census tract and COVID-19 vaccination rate data by zip code. And so in this middle picture, you can see the colors correspond to specifically for this picture, SVI by census tract, which green indicates low SVI, and red being higher SVI. You can't really see the color coordination corresponding to the fully vaccinated or vaccination rate data, but that's a separate mapping feature. We also found that community health workers use information on this map to locate potential community partners, log their interactions, and draw pins with details about potential new community partners. And CHIRP as a platform allows community health workers to enter data about who they've worked with. And then this can be assessed by managers and designers to improve the program itself and report to the funder.
So overall, to conclude our analysis of using this platform in the vaccine rollout for COVID-19, there were certain areas that weren't reached with the vaccine as much as other areas, and a lot of that had to do with health inequities that the health workers identified as they spoke to these communities. So this can be potentially a great tool for anything you're trying to do widespread over a community, like vaccinations, or even just preventative health measures, like being able to talk about, for example, a lot of workers started talking about like reproductive health with some of their people. So if you're able to track who you've spoken to and what you've spoken to them about, there's less redundancy when other organizations might also want to have some sort of intervention in that area. They can see what has and hasn't worked in the past. So this can potentially address, going back over the same topics, and it can be a more effective way of speaking to these communities in the long term. So we're excited to do a thematic analysis of all these interviews by coding the transcripts and putting them in something called Atlas TI, so that we can see the pattern of what sort of topics are talked about and how frequently and in what areas.
Well, thank you very much. This is a really interesting kind of integration of technology in terms of tracking the efforts of the healthcare providers in a wide geographical area. One of the things that you touched on. I'm not familiar with CHIRP, obviously, so thank you for introducing it. You touched on that it can prevent kind of redundant efforts in terms of community outreach and kind of increase the efficacy of that. Is there any sort of method of tracking whether there might be a positive correlation with repeated presentation of the information with patient retention and healthcare decision making, or is that kind of outside the scope of this particular software?
So this software has focused more on people who are implementing preventative health measures. So for example, they might have health fairs at schools or in churches was one of the methods they like to use, but they themselves are not healthcare workers that can provide the vaccines. So it was more like gathering on the ground information about why people weren't getting the vaccine. But if it's all organized in a database that healthcare workers can perhaps view themselves, then they can know how to speak to their patients and how to approach them in a more effective way that might get the ball rolling on some of these preventative health measures.
Okay, well, thank you very much.